leg swelling during pregnancy, what causes leg swelling during pregnancy, and how can mothers prevent or reduce it. Various factors contribute to foot and ankle swelling during pregnancy. From this, your body retains more fluid during pregnancy. Also, your growing uterus puts pressure on your veins, which impairs the return of blood to your heart, and hormonal changes also play a role. Foot and ankle swelling during pregnancy is common and usually goes away after delivery. In the meantime, pregnant mothers can reduce it by doing the following thing. The first is stay off your feet. Avoid standing for long periods. When you can, sit with your feet up and occasionally rotate your feet at ankles and gently flex your feet to stretch your calf muscle. Better yet, lie down with your legs elevated. The second is sleep on your left side. This takes pressure off the large veins that returns blood from the lower half of your body to your heart or inferior vena cava. It also might help if you elevate your legs slightly with pillows during sleeping. The third is wear compression stocking. As you see on the image, your healthcare provider might recommend wearing supportive tights or stocking during the day. The other is be physically active every day. Take walks, ride a stationary bike, or swim laps in a pool. The other is wear loose clothing. Tight clothing can restrict blood flow. Don't wear socks or stockings with tight bands on the ankles or calves. Although mild foot and ankle swelling during pregnancy is normal, sudden swelling that is painful, especially if it is on one leg only, could be indication of blood clot or deep vein thrombosis. A sudden increase in swelling also might mean that your blood pressure is higher than normal or hypertension might happen. So, those conditions require prompt evaluation and treatment. This is all about leg swelling during pregnancy. Thank you for watching and don't forget to subscribe.